Good morning and welcome to your weekend healthy chat. I'm your host, Dr. Sara, and today we have a great show for you with two guests. First, we have Amelia Devlin, who is the Middletown Community Health Center Milford Site Manager. Good morning, Amelia.
Good morning, Dr. Liz.
We're very lucky to have you on the show. So let's get started. So tell me a little bit about yourself and how you became involved in this type of work.
All right. Well, I'm a registered nurse. I graduated 3 years ago. And pretty much started with MCHC right out of school.
Oh,
when
great.
I went to school, when I did my clinicals, I found that I really enjoyed public health.
Mm-hmm.
And was lucky and fortunate enough to find MCHC when I graduated.
Mm-hmm.
And they picked me up, and here I am.
Oh, great.
And I really enjoy it. I love it. I love working with the community and getting out there. And
Well, it's very nice to have you in the community.
Thank you.
We appreciate it. So now, where are you located exactly? Because I know that the Milford site is relatively new. So when did it open and where are we located?
Okay, we opened on Monday, March 3rd. So we've been open about 3 weeks now.
Yeah, close to a month.
Almost a month, yeah. We're located at 221 Broad Street in Milford, Pennsylvania. And if anybody's familiar with Milford, it's right in downtown Milford on that main stretch, right next to Freda's. That's what I tell everybody. It's right next to Freda's Italian Deli. Everybody knows Freda's.
Exactly.
So if you know Freda's, you can find us easily.
Very nice.
Yep.
Now, what services do you provide?
Well, right now we provide women's health, OBGYN.
And who's the provider?
It's Dr. Neela Singar.
Mm-hmm. Who's been in the community many years.
Many years, yep. She was out in Milford, so she does have a large patient base with us out in Milford, and she's been to our Middletown office and Port Jervis, but now she's back to Milford, and we're very happy to have her, and the patients are as well. They're very excited.
God.
So right now we do have women's health, OBGYN, like prenatal care, and we will hopefully by the summer we'll have pediatrics and internal medicine as well.
That'd be great. So to really offer all three services.
All
so
three.
When will the listeners know the actual date for?
Well, we don't have an actual date right now. We're still in the process. And as soon as we know, I'm sure we'll have it listed on the website.
And what's the website, just since we're talking about it?
Well, it's www.mchc.org. And you can give us a call, too. We can give the phone number out.
Yeah, sure.
You can always call the office with questions. But we don't have a definite date, but hopefully by the summer. That's our goal.
And what's the office phone number since you brought it up?
It's 570-409-6212.
Great. Well, perfect. So now what are the hours that are currently located at the Milford site?
Currently, we're open Monday through Friday, 9 to 5. And when we do have pediatrics and internal medicine up and running, we'll definitely be expanding to weekend Saturdays and probably 1 or 2 evening nights as well, till about 7 o'clock.
That'd be great.
Yep.
What an asset.
Yes.
And what type of insurances do you accept?
We accept... Well, that's one thing that's great about MCHC is we accept self-pay patients who are underinsured or not insured at all. We work on a pay scale based on your pay, but we also accept private insurances, managed care insurances. If you have any questions, you can just call the office and tell us exactly what insurance you have, and we'll tell you if our provider accepts that insurance. We are in the process of being credentialed with more and more insurances, so that's why it's safe to just call.
Right.
Call the office.
Because it can change any
It changes all the time.
Absolutely. Even for our office, it can change every day.
Yes, it does. So definitely call the office at all if you have any questions, and we could tell you the most up-to-date information as far as insurances, what we accept, what we don't accept. And if we don't, we can find you somebody who does accept your insurance.
Absolutely.
Yep.
Now, do you accept walk-in patients or are these by appointments only?
We do. Well, we definitely like patients to call in advance and set up an appointment. But if you can't and you find out that you have off that day and you want to come in, you can walk in and we will do our best to accommodate you. Right now, our goal is to have a provider on site 5 days a week. But right now, we don't. She is there at least 3-4 days a week. So in the event that you do walk in, there's always that possibility that the provider won't be there. And that's right now.
Not there. There's other ancillary staff.
Exactly.
So who else is
exactly.
there?
So we do have nurses. So I mean, if you have a concern,
a triage situation.
Exactly. We do have nurses on staff. So if you think you have a minor emergency, I want to say, you can come in and speak to one of our nurses, and if they'll give you their professional opinion, they'll triage you. And if we think that you need to see a doctor, we'll send you to one of our other sites or the emergency room. the nurse would triage you. And
Right.
we'd go from there.
And one of the closest sites is the Port Jervis
Exactly.
office where I
Yeah.
currently am.
Yeah.
All right, perfect. And anything else you want to add before we close up?
Not really. Obviously when it comes to the appointments, we do recommend that you call in advance. But if you can't, like I said, it's not a big deal. You can always stop in. And as we grow, as the office grows and we get pediatrics and adult medicine, we will always have a provider on staff. I just want to say, right now, things, are just opening up and Dr. Singar is there a couple days a week. But we will ultimately be there 5 days a week, and we will have providers on staff 5 days
And you
a
always
week.
have somebody there 5 days
We
a
do.
week, whether it's a nurse or
Yep.
yourself.
Yep.
I hear there's going to be an open house coming up in the future.
There is. We don't have an exact date yet, and if you're interested, you can just check out the website. We'll post it as soon as we know. But we definitely invite everyone in the community to come out, check out the facility, see what we have, and
Go from
definitely
there.
come on out.
All right, perfect. And if you just want to list the phone number again and then the
Sure.
website.
Right.
just
So the phone number, the direct phone number to our Milford office is 570-409-6212, and the website is www.mchccares.org.
All right, perfect. Well, thanks so much for being here today. We appreciate it.
Thank you very much.
And we'll be right back after this. Welcome back. Now, changing gears a little bit, I know we were just talking about our Milford site, but our second guest today is Casey MacDonald, who's the Executive Director for Hudson Valley Cancer Resource Center. So good morning and welcome.
Good morning. Thank you for having me.
Well, we're very happy to have you on the show. So tell us a little bit about your focus, mission, and the target population that you serve.
Well, our focus is, or our mission, is to connect cancer patients and their families to all the resources and services in the entire Hudson Valley. We serve from Westchester to Albany, including Rockland and Sullivan, including this area also. And what we do is we connect cancer patients to all the ancillary services they need most. Things like financial assistance, copay assistance, prescription assistance.
Great.
Anything that helps make their cancer journey easier.
Absolutely.
Our primary target is the cancer patient and their family or their caregiver. We also help healthcare professionals help their patients to find those services that they need.
Very nice. Very nice. Now, how do you connect cancer patients and their families to services and programs in the region?
Well, we do it on a national, state, regional, and local level. So when a cancer patient calls our office and say they need financial assistance, depending on the type of cancer that they have, we can help them search for organizations that deal specifically with their cancer and provide financial assistance. And then we can also find them local resources that are available right in their community or their region.
Very nice.
So if a cancer patient calls and they're looking for financial assistance, maybe we can connect them with Cancer Care, which helps them pay for transportation expenses to treatment. It also helps pay for child care while they are undergoing treatment. For a breast cancer patient, we might connect them to something called the Pink Fund.
I know, what's that?
It's an organization that helps young women get back on their feet after breast cancer or during their breast cancer treatment. Financial assistance is probably the number one request that we get, because I always say no matter how much money you have, you never have enough when you have a cancer diagnosis. So that's the number one stressor that really affects most families when there's a person with cancer in their household.
No, absolutely. Now, why are you an important resource for cancer patients and their families?
Well, we are the only resource in the region, in the Hudson Valley region, and we cover these 10 counties.
Oh, wow.
We're the only resource in the entire region that helps you regardless of where you're being treated, where you live, what your cancer diagnosis is. We are not affiliated with any of the hospitals. So not that we don't work with them, we do work with them, but
and there's no affiliation.
There's no affiliation. So if you're being treated out of your home area, it's very difficult for your treatment center. Say if you're down in the city, if you're in New York City being treated. Whoop, I think there's my cell phone going off. If you're being treated in the city, your social worker or your patient navigator that's assigned in New York City isn't necessarily going to know what the resources are in your home area or where you can find local resources. Say if you need a wheelchair or a cane or an electric bed to help you while you're undergoing treatment. Your cancer patient advocate at a local center down in the city, they're not going to know where you can go that's right in your neighborhood or right in your county. That's why we're vitally important.
Absolutely. So now, how are you changing the game of information, not only for patients, but healthcare providers of oncology patients?
Well, one of the ways is we educate healthcare professionals about where our resources are, where there's resources in the county. Because we cover such a wide area, there's a tremendous amount of resources, but it's just like the healthcare system. It's very fragmented. So when you go on to Google, you'll get 1 million hits. Well, we've eliminated the hunt and peck in trying to find all of those resources. Our website is hudsonvalleycancer.org, and we say it's an online navigational tool for patients to find what they're looking for. We designed it, and we always tell people that it's so easy to navigate. Your 6-year-old grandson could navigate it for you or with you. And it has every listing of every resource that's available for a cancer patient, like I said, on a state, national, local, or regional level.
Very nice. So now, speaking of the website, so how do you navigate through it? Can you give us some examples?
Sure. When you go on to our website at hudsonvalleycancer.org, you'll pull up one of the tabs, say, for your diagnosis. You can pull up your diagnosis first. Say you have lymphoma. It will bring you onto the page that lists all of the major organizations that are dealing with lymphoma, that are the major organizations that provide resources, information, education.
Right.
Then you can take your diagnosis, and there's a slide out tab that will go to your county in which you live. And then you can see all the resources that are available for a patient with lymphoma in the county in which you live. There's no other website like it in the region.
Yeah, that's amazing.
It is amazing. We're really proud of it. It's a really great tool for patients.
Yeah, that
not
is.
Only yeah,
and
not only
to
for
be
patients.
so user friendly.
It's so user friendly. It's so simple to use, and we designed it because cancer is primarily a disease of the aging. So there's a large population of patients that aren't necessarily computer literate, and we want them to be able to access our information. So it is very simple and easy to navigate through it.
No, that's great. And it's nice to have that resource. And I know your programs are offered at your Montgomery office, and I heard that these are support groups for young adults.
We do. We have a support group for young adults. It meets once a month. It's usually the third Wednesday of every month. With the winter, we've had to change it around. We keep having the snow that's coming supposedly this week. But it's a support group for young adults ages 14 through 20, and this is a support group for teens that have been directly affected by cancer, meaning that they have been the cancer patient themselves.
Wow. There's
support groups out there for families with a child of cancer, things like that. This is the only support group in our region that caters exclusively to teens with cancer.
That's impressive. Is it a decent-sized group that comes to meet together?
Right now we have 5.
Okay.
We would like it to be a little bit larger, but right now we're serving 5 teenagers that need support.
Yeah,
so
that's nice to have that outlet.
It's really nice to have that outlet.
Especially during the teenagers where no one wants to talk anyway, regardless. And then to have it, especially to have a diagnosis as devastating as that. I mean, it's nice to have that outlet and that support structure. Right.
Well, it's really important, too, for our teens because we do have several that are amputees. So here they're starting their young life with a disability that is going to be a lifelong reminder of their cancer experience. So it's vitally important that they get the support they need to be able to launch into adulthood.
Absolutely. Now, I know you have some events coming up over the next couple of months. So what are these?
We do. We have very exciting events that we're so excited about. We are doing a March for Cancer 5K run walk on Sunday, March 30th over at Orange County Choppers. They are hosting us.
Very nice.
Paul Sr. will hopefully be starting our starter pistol.
Yeah.
That's March 30th. We'll also have a balloon release at our race.
And what is that?
The balloon release is going to be where runners can write the name of a loved one who's been affected by cancer. And we'll remember them and honor them and at our balloon liftoff.
Very nice. And what other events do you have coming up?
We also have a Cancer Survivorship Summit.
What's that?
Our second annual. Last year, it was the first one that we brought to the Hudson Valley. We've never had a Cancer Survivorship Summit here. It's an all-day conference for cancer patients, cancer survivors, healthcare professionals.
Very nice.
Cancer caregivers. And it is an all-day conference that we will have a couple of keynote speakers and breakout workshops. And it's really to focus on getting back to life after cancer, living and loving your life after cancer. It's very difficult to to go through this process of having cancer and then getting back to your routine. I hate that phrase, the new normal.
Right.
But you do have a new normal after going through treatment. So, and it's an area that we really like to concentrate on. We have 14 million survivors in this country, and they have certain needs.
Absolutely, yeah.
After undergoing treatment. So,
and when is the summit going to be?
The summit is April 26th.
So coming up.
It's coming up quickly. And it's from 8 a.m. to 4 p.m., and it's going to be held at SUNY Orange in the Newburgh campus at Kaplan Hall.
Okay, and how does somebody register for that?
So they can go on to our website, which is hudsonvalleycancer.org. There'll be a little tab on the left-hand side, which will say Hudson Valley Cancer Survivorship Summit.
Okay.
All registrations should be up and loaded by the end of this month. Right now, they can go on to see last year's summit. We had the deputy chief of Sloan Kettering, who was our keynote speaker. This year, we'll have the head of genetics from Sloan Kettering as one of our keynote speakers.
Very nice. And now, how can our audience help the Cancer Resource Center? What can we do?
Oh, there's so many things that they can do to help us. Well, one is they can volunteer at our center. We have a committee for fundraising. We have a committee for our support groups to help with that. They can even just pass our word around, let people know that we exist, that we're here as a resource for cancer patients and their families.
What a great resource it is.
Yeah, we're really excited. We've been here for about 18 months. We launched our website in September of 2012. We moved into space in Montgomery. One of our board members gave us space in his building. And from February 2013 to the end of December, we had helped 115 families.
Wow, that is amazing.
Yeah. This year, we're on track to help about 250.
Wow, that is great.
So, yeah.
And anything else you'd like to add before we end our session?
No, just that use us as a resource. We have Google Analytics embedded into our website, and we could tell where people are going to and what sites that they're looking for. Check our website out. It's hudsonvalleycancer.org. If there's a resource on there that you're familiar with or your organization provides a service for cancer patients and it's not listed on our site, let us know about it. We'd love to be able to put it on our site and let others know in the region about it.
Okay, great. Well, thank you so much for being here today and for all the work that you do for the community. We appreciate it.
Thank you. Thanks for having me. I appreciate it.
And we'll be right back after this. So now it's time in our show for our email question of the week. And this mom writes, Dr. Sara, I've been hearing a lot of buzz regarding the HPV vaccine. What is it and what age should my child receive it? Well, first, let me start by saying HPV is short for human papillomavirus. Now, there are about 30 to 40 types of HPV that can affect the genital area. And according to the Center for Disease Control, or the CDC, there are about 6 million new cases of genital HPV infections in the United States each year. It is estimated that 74% of them occur in 15 to 24-year-olds. For most, HPV can clear on its own, but for others who don't clear certain types, HPV could cause significant consequences, such as cervical cancer in females, and other types can cause genital warts in both males and females. And there's no way to predict who will or won't clear the virus. Now, the HPV vaccine for females helps protect against 2 types of HPV that can cause about 75% of cervical cancers and 2 more types that cause approximately 90% of genital wart cases. In males, HPV vaccine helps protect against approximately 90% of genital wart cases as well. The vaccine can be given from ages 9 to 26 and is a 3-dose series. In my office, I generally start the conversation about the vaccine at around ages 10 to 11 to give parents time to consider it. I hope this helps answer your question, and for further information regarding the vaccine, please feel free to visit the CDC website and/or talk to your pediatrician. For those of you with further email questions, please feel free to email me at drsara@middletownchc.org. Again, that's DRSARA@middletownchc.org. I just want to thank our two guests for being here with us today. I want to thank Casey MacDonald, who is the Executive Director for the Hudson Valley Cancer Resource Center, who we just learned is one of 3 finalists for a nonprofit innovation award that's going to be given out at Bethel Woods, so we wish her the best of luck. And I also want to thank Amelia Devlin for being with us today. She's the Middletown Community Health Center Milford site manager, and congratulations on the Milford site being open earlier this month. I just want to say have an active and healthy week ahead, and I'll see you again next time. Take care.